French cuisine is a big part of their culture and may affect their health lifestyle. The French prefer to associate food with socializing on all socioeconomic levels, thus causing them to have lengthy dinners. Many French foods include heavy sauces and breads are a staple to every meal. However, all their foods are very fresh and organic. Since cuisine is such a big part of their culture, the French take a lot of pride in what they eat and how they prepare it, which causes them to have a healthier diet when compared to other countries. Wine is also a huge part of their culture and is used as an accessory to the meal rather than just a drink. The French enjoy their wine, which can have health benefits because they do not drink in excess, but rather to enhance their meal. Taking these aspects of French cuisine into healthcare, the French eat healthier, which allows them to have fewer health problems that are related to diet.
Economic system of the country. The French Republic is the second most populous, the second largest economy, and is the world's fifth largest economy. France still struggles with unemployment, lying at 9.8%, which is higher than other European unions. Although they still have a strong economy, with privatism of many state-owned businesses. The expenditures are, as a share of GDP, gross domestic product, are far lower than the U.S. Healthcare plans. The French health system combines universal coverage with public-private mix of hospital and ambulatory care and a higher volume of service provision than in the United States. Health status, along with consumer satisfaction, have been really high. Healthcare was rated number 1 in 2000 by the World Health Organization and was dominated by solo-based fee-for-service. Financing of healthcare. France had the NHI, which stands for National Health Insurance. This covered salary workers in industry commerce, where wages were under low ceiling. Like Medicare in the United States, French National Health Insurance provides a great degree of patient choice. The French National Health Insurance increases as individual costs increase. The National Health Insurance, financed by employer payroll taxes and general social contribution. Supplementary income tax, 5.5% of wages, were raised for the National Health Insurance. Physicians in private practice are paid directly by patients on the basis of a national fee schedule. Patients that are sick in France only means that the health insurance coverage improves.
In 2000, France was ranked number 1 by the World Health Organization for best healthcare. France works to create universal healthcare without eliminating private insurance, which is a great benefit to give people more choice. After more than half a century of struggle, in January 2000, France covered the remaining 1% of its population that was uninsured and offered supplementary coverage to 8% of its population below an income ceiling. The NHI covers over 70% of medical expenses, while the rest is covered by insurance or individual's employer, which means less money coming out of pocket per person. There is no restriction on how many visits one can take to the doctor or when they do decide they want to access care. People in France have been known to live longer and healthier lives than those in other countries, and over 55% of the population in France are satisfied with their health care coverage.
In France, primary health care is provided by 23,000 general practitioners who are self-employed professionals who work in a group, practice, or on their own. Citizens are free to choose the GP they want and can consult any other GP they wish, but only their personal doctor they are registered with can refer patients to a specialist under their healthcare system. Patients have to pay a flat rate fee for any visit to a general practitioner, which in 2012 was about 23 euros per visit. Most of the cost will be automatically reimbursed to the patient by the state-run health insurance provider. The GPs in France sign contracts with the National Health Insurance to provide their services at the nationally agreed rates. Senior care in France. The average life expectancy in France is 81 years old, compared to 70 in the U.S. French patients have just as much doctor choice as Americans, and they don't have deductibles, just modest copays that are dismissed for those with chronic illnesses. There are different types of retirement and care homes, as well as different care options for the elderly in their own home. Retirement homes in France are often privately run, usually by businesses or nonprofit organizations. Some people may qualify for the APA benefit, which is for elderly people, and it's aimed at helping them to live an independent life. It can be used to pay for things such as daycare, specialist equipment, or any modifications which are needed for the living environment. In 2010, the cost of care for the elderly in France was estimated at 34 billion euros, 77% of which was covered by the public sector.
Veterans Care. For those who have served for the French military and had achieved 40 years' worth of payments, they are entitled to a pension of up to 75% of their salary from the last 6 months of their service. If 40 years was not quite achieved, there is a system to calculate the pension based off the earnings that were paid to them. Based off of these pensions, veterans are able to purchase private health plans if desired, in addition to the universal health coverage which is already applied. Unique facts about France. The number one cause of deaths are lung cancers in the country. The government has quite the control over its people and is able to dictate what a child can or cannot be named. The world's first successful artificial heart transplant took place in Paris, France, and is said that it is able to beat for at least 5 years. Potatoes were illegal in France from 1748 to 1772 due to the idea that potatoes were the cause of diseases such as leprosy. The average French native eats up to 500 snails per year, and believe it or not, they are very nutritious and can help with weight management.